so lovely to be here with everybody in this room. Some of you I've already met online before today, some of our early sign-ups to the study. So thank you so much for being involved in research if you've already been involved in our study, and thank you for anyone who signs up from here on. So my name's Miya St. I'm a speech pathologist, that's what we call it in Australia, but an SLP, speech language pathologist, is what you might have heard it called. But I'm also interested in rare genetic conditions. I'm particularly interested in this space, and I've been working in this space since I graduated. I work in a number of different conditions, and usually we're the ones that are trying to get funding, but I was actually approached by Gabrielle to say, can you please do a study with our condition? So it happened in a little bit of a different way for this group, which was really nice. It didn't feel like I had to fight to get some funding to really fight for speech and language research, because sometimes we don't get respected in the medical community, but it's really nice to see that you're on board with us. So today I'm just going to introduce our project and what it looks like, what it would look like for families who are taking part, what you would do if you were involved, and why it's really important that we do this type of research. So this is where I'm from, just a little bit of a background. This is my research team, not mine, but the one that I am part of. So my research team's led by Professor Angela Morgan. She's a pretty amazing researcher in speech, language and genetics, or rare conditions. So this is our team here. This is just some of our team. We've got lots of speech therapists on our team, but we've also got a wider team of bioinformaticians, epileptologists, we've got neuropsych, physiotherapy, lots of different professionals who help us to understand speech and language as well. I'm based at the Murdoch Children's Research Institute, which is that building in the top corner. And then I also work at the University of Melbourne as well. So that's where I am and where I'm from. And I put the 2 stars on the map to show where I've come here today. I was in Chicago first, though. I've been in a few different spots. All right, so this is a little bit about us. So this is our Translational Centre for Speech Disorders. We're an international collaboration of fields of speech pathology, like I said, paediatric neurology, neuroscience, genetics, bioinformatics, and our vision as a team is to improve the outcomes for kids with speech and language conditions. We have a particular interest in a speech condition called childhood apraxia of speech, which some of you might have heard of already if your kids have been, that's been mentioned to you. So that's kind of an area that we're really interested in. But we also look at other speech and language conditions too. So I'm going to give this background on speech and language. I do this for lots of family talks because it's a distinction that is often not made, but it's really important clinically. So speech and language come under the umbrella of communication more generally. So in this bubble here, we've got speech. What does that mean? So speech is the production and the perception of speech sounds. So that's how our sounds are made when they come out, how they sound, how we move our lips and our tongue and our teeth to make the accurate sounds. Whereas language is the production and understanding of words and grammar to communicate meaning. So that's thinking about vocabulary, syntax, all those things that we use to put words together so we're making meaning and we're understanding others. So they're 2 completely different things. So if, as an example, if someone was trying to say this picture here, I know it's a rabbit. If they said wabbit, they know what that thing is. They know that it's a rabbit, but they didn't quite get the sounds right. So that's a speech challenge. If they looked at that picture and they said cat, well, that would be a language issue. So they don't have the vocabulary for that animal, that thing, whatever it may be. Another example might be if you ever got your wisdom teeth out and you're trying to speak and you've got all, everything's all numb and you can't, any sort of dental surgery, and you can't speak properly and everything sounds a little bit slurred, you know exactly what you want to say, but the sounds aren't coming out right. So that's a speech challenge. You don't have an issue with language, you know what you want to say, you're understanding everything around you, but the sounds aren't coming out quite clearly. The reason it's important to make those distinctions is because we treat speech conditions and language conditions completely differently. They're completely different therapies. So it's great that Simon's Foundation and other research papers have said, yeah, speech and language is really affected in this group, but we need to whittle that down a little bit more. What are the exact speech conditions and what are the exact language conditions? Because that's how you're going to know how to then treat. What therapies are going to work best for my child? Just saying speech and language, that's too vague. It doesn't give us enough direction to know how to treat that condition. So under the language banner, we can talk about receptive language. So that's what we understand others are saying to us, how much we understand. And a lot of families have already said, I think my kid understands more than they can communicate. So they might have better receptive language than expressive language. The expressive is what you can communicate. The receptive is what you understand others are saying to you, both in written and vocal forms. And then we can talk about social language as a little bit of an aside, but how we use context, what's appropriate to say at different times. That's another element of language as well, but more the social context. And then under the speech banner, we've got a few different conditions. So we've got articulation disorders and phonological disorders. These are pretty common. It's what most speech therapists are used to seeing. It's your bread and butter speech pathology. It's a lisp, for example. It's the rabbit to wabbit. We hear those things in clinic. Speech pathologists are used to treating those things. They know how to treat those things. And it's fairly easy to treat those conditions. We've got clear protocols that we can use. They're pretty amenable to treatment. And then we've got these other conditions here. Childhood apraxia of speech, dysarthria, and stuttering. There are speech conditions that are what we call motor speech conditions. So it's something to do with the motor movements for speech. These conditions are generally more rare, so we see them a lot less often, and they're a lot more difficult to treat. So we don't have therapies that work super well all the time, or the therapies that we do know work well, we need to do really intensively for a really long time to see change. So they're harder to treat and less amenable to treatment. Particularly childhood apraxia of speech and dysarthria, they're both seen in about 1 in 1,000 kids that would come through a typical speech clinic. So often clinicians aren't really confident in giving a diagnosis of either of those things, let alone knowing how to treat them, because they're just not things that they see often. Stuttering is slightly different because we do see stuttering a little bit more often. You see stuttering in about 11% of the typical population, but 70% of those kids naturally resolve. So what is it with the other 30% that aren't naturally resolving? And sometimes we see that in our genetic populations, that they're less likely to resolve stuttering over time. So that's my little background on speech and language. The reason why it's so important to break that down is because the treatments that we use to treat these conditions will be completely different. You might spend months or perhaps years treating what your therapist calls an articulation challenge, when actually what they're looking at is childhood apraxia of speech. And an articulation therapy approach will not work for a child who has childhood apraxia of speech. So you've got to get that diagnosis right from the beginning to know that you're actually not wasting your time with an incorrect therapy. There are motor speech ones that I highlighted in yellow. Okay, so what do we generally do or typically do in our research team? So we take a group of kids that all have childhood apraxia of speech. That's our real passion area and interest because it's so complex. So we take a bunch of kids who have childhood apraxia of speech, we get a cohort that we study and do lots of speech testing. And then we do some genetic testing and genetic sequencing and have a look at whether there were any genetic changes. We find that genetic change in that individual. We see that in about 30% of the kids that we bring through with childhood apraxia of speech. We have about a 30% hit rate to find a genetic change for their childhood apraxia of speech. And then we find other kids that have that genetic change. And then we do a study on all those kids with that genetic change. And that's when we do speech and language phenotyping or phenotyping. And so we want to know what is the speech and language of all the individuals with that specific genetic change, like in OCNDS, for example? Do they all have CAS? Ooh. Do they have different conditions? Do some kids have more mild CAS? Are some kids have a combination of CAS and stuttering and dysarthria and language challenges as well? Is there a spectrum, or is it really homogeneous? Are they all really similar? That's the question that we want to ask. So are they similar? Are they different? What's the spectrum and what's the profile? So that's what we're doing here with this study, is to understand what is the profile and what is the spectrum, and therefore how can we best treat those kids? What are the best therapies that we can use? We came about it in a bit of a different way because we didn't get to it like this. We got to it because Gabrielle sent me an email and said, hey, I saw you were doing a study in something else. Can you do it in our condition? These are just some of the other genetic conditions that we've looked at and studied. This is just a handful of the ones that we've studied, but there are more than this. And this is just, I've just pulled out a few examples to show how different the communication is in some of these conditions. So what did I put first? Okay, Coulin-de Vries syndrome. I was at a conference for Coulin-de Vries syndrome just yesterday in Chicago. That's why I was in Chicago. So we did a couple of papers on this condition where we profiled the communication. First, we looked at 49 kids. Then we had about a sample of 80 kids. It's a little bit more common than OCNDS, so we were able to get a big sample. Oh, that keeps just pressing when I'm not pressing it. Okay. And what we found was apraxia was a core symptom of that condition. So now we know, and what I could go and speak to the community on yesterday and the day before, was the specific apraxia approaches that would be perfect for that condition. Another condition is Klinefelter syndrome. So we studied Klinefelter syndrome and we found that actually apraxia wasn't a core condition. It wasn't really a speech motor challenge. It was more language challenges that these kids primarily had, and literacy challenges, so struggles with reading and writing. So then we can figure out, okay, now we want to do some literacy approaches. That's going to be most beneficial for those families. And then another condition that I worked with was CAT6A syndrome. So that's another genetic condition. These kids were much more minimally verbal. So we found that 70% of those kids weren't using speech or language. So they had struggles across the board. And in other challenges as well, motor, fine motor, cognitive challenges. It was a little bit more of a global challenge. So for those kids, we could recommend what we call AAC. So alternative and augmentative communication, like devices. You want to start implementing a device young if we know that 75% of kids are not going to end up speaking. So this is why it's really important to know what the trajectory looks like so we can then give recommendations young. What do we know about speech and language in OCNDS? These are some quotes from different papers that I've read. So delayed communication milestones. Okay, we know that maybe speech comes on a little bit later. I heard that today. Someone said 8 years old. That's super late. So we're starting to get that idea that communication milestones are delayed. Atypical oral motor skills, so using the mouth, the tongue, the lips, not for speech. Okay, we're starting to get a bit of a picture. Delayed literacy development. Okay, so now we're getting into the language side of things. And then we see lots and lots of papers talk about this general impaired speech ability, impaired speech and language. It's too general for us to know exactly what to do. The exact profile is not clear, and it's really important for us to know for treatment. So our research aims in this study is to characterize speech and language in a group of individuals with CSNK2A1 variants. We aim for about 50. That's the aim for our paper. The more, the better. If we can get more than that, even better. And why would we do that? To provide a clearer communication diagnosis, therefore a clearer prognosis and treatment plan for families and clinicians. We want to look at that genotype-phenotype correlation. Are there particular areas of the gene that mean that speech and language will be more impacted? Will it be more of a motor speech profile versus a language profile? And then we can use that data to inform future speech and language outcome measures. We've talked a lot about outcome measures today in lots of other areas. So how can we use some of our speech and language outcome measures as well for those future studies looking to beyond? This is how we collect our data. So it's a combination of online surveys, and online standardised assessments. So you're pretty familiar with it, I'm sure, from other things you've been involved with, being sent a link and completing a survey. We do some face-to-face assessments. So if I have people in Melbourne, I do a face-to-face assessment with them where I do a speech and language battery. It's pretty low-key. I'd like to keep it pretty relaxed so I'm not putting lots of pressure on the child. And then we can do it via telehealth. If the child's able to and the family's willing to do that, we do a speech assessment over Zoom. And then sometimes we ask families to upload a video of their child's communication. So I know that for some kids who communicate in other ways, like use speech devices or picture communication systems, I can't assess that over Zoom very well. I'm not seeing the best of your child when they're sitting there on a computer screen with someone they've never met before. So in that case, I would get a family to maybe send me a video of a really good communication interaction so I can get an idea of what the language is like. And we also get families to upload reports of various things when it's relevant. So families will start off by consenting. When we look at medical history, neurodevelopment and adaptive behaviour, so that's part of our study as well, we get families to upload past reports if they've done them already and complete some online surveys. And then, of course, we've got kids who are verbal and more minimally verbal or non-speaking. So we send separate assessments that cater to your child's specific skills. So you're not getting all the verbal questionnaires if your kid's not speaking yet. Why would we do that? So we kind of cater the battery depending on your child's skill level. We look at feeding. So we'll send some online questionnaires to both the non-verbal and the verbal groups. We might do some assessments via telehealth with our verbal or speaking kids to assess feeding and oral motor skills. We, of course, look at speech. So that's the production of the speech sounds. So for that, we'll do our telehealth assessment with the verbal kids. But even for the non-verbal kids, we can look at really early pre-linguistic skills that might indicate later speech and speech motor development. So for that, we've got some standardised questionnaires. So we're still assessing the speech profile, even for the kids who are non-speaking, because we can assess those early predictor skills. Language, again, we're doing online surveys and a telehealth assessment. So we'll do some language assessments. And then for the minimally verbal or the non-speaking group, we'll get you to maybe upload some videos, like I said. And again, we've got standardised questionnaires that will assess language in our minimally verbal or our non-speaking kids. This is just an example of what a survey might look like. That's the beginning of it. But at the end, you can see it says, okay, we've got a bunch of sections here, and there's a button there that says save and return later. So for anyone who's already completed this study, you'll know that some of our questionnaires are kind of long. We don't want to miss anything because we want to get all the information. But this is something that you can do incrementally. You don't have to finish a whole, 10-page survey in one go. Save it, return to it later when you're sitting on the couch or something, and you can do it on your iPad when you're not distracted by other things. We appreciate how busy families are, and so we try and make the study as flexible as possible. I'm up at all hours doing assessments with families in all parts of the world, and I'm happy to do that because I get the best out of kids if I'm seeing them at a time that suits them. This is our flyer that you might have already seen online. I've put a QR code there. It's to our expression of interest form, and you can sign up to that, click. Don't feel like you're obligated once you sign up. I'm still going to send you a consent form and talk you through any questions that you have. And also I'll note that we have our surveys in a bunch of languages as well. So I only speak English, sadly, but we have a bunch of our questionnaires available in French, Dutch, German, Spanish, Portuguese, Italian, Chinese, Bulgarian and Polish. Some of our questionnaires aren't available in all languages, but that's okay. We'll get whatever data we can get and we'll work with whatever we can get. I'm often using Google Translate to send my emails to families in different languages as well, so I'm trying to get as much as I can. In terms of who we're looking for the study, we are looking for anybody 6 months and older. So babies, young children, adults, anyone, whether you are speaking yet or not speaking yet, whether you're doing speech therapy or not doing speech therapy, whether you feel like this is a huge issue or whether you think, actually, no, my child's speech and language is pretty good. We want to get the whole spectrum of abilities. So pretty much anyone can be involved, as long as you have OCNDS. And that's pretty much it.